Chapter 31 Older Adults. For our first case study, Mr. Nixon is being admitted to a short term care facility because his wife, who had been his only caretaker, has recently died. His son, who lives about 250 miles away, has been staying with him for the past 4 weeks, but has to go home now to go back to work. Mr. Nixon has COPD and has trouble getting around because he's short of breath. He's still grieving, of course, but his son shares that he feels his dad has been depressed over his health, off and on as well. You'll be doing an intake assessment with Mr. Nixon. Americans are living longer and longer due to better technologies, medications, better long-term care facilities, and long-term care. And this life expectancy and number of older adults continues to grow as a result. The most common classifications for older adults are the young old between 65 to 74, middle old between 75 to 84, old between 85 to 100, and centenarians over 100 years old. And as society continues to grow older and older, they're also going to come with comorbidities, and these includes mental health comorbidities, such as late life mental illness, major depressive disorder, suicide, anxiety disorders, delirium secondary to a general medical condition, neurocognitive disorders, alcohol disorder, and pain. When dealing with pain, there can be many barriers in the elderly to accurate assessment. We can use some assessment tools such as the Wong-Baker Faces Pain Rating Scale or the Pain Assessment and Advanced Dementia Scale. Pain management would take many forms. It could be pharmacology, non-opioids, opioids, and non-pharmacological treatments, including physical therapy, vagal nerve stimulation, exercise, hydrotherapy, heat and cold packs, chiropractic, and transcutaneous electrical nerve stimulators. Also things like yoga, biofeedback, hypnosis, acupuncture, massage, Reiki, guided imagery, reflexology, and therapeutic touch. These are integrative therapies for managing pain. They could also be used in conjunction with herbal remedies such as cayenne, capsaicin, ginger extract, echinacea, kava, and even willow bark. The other healthcare concerns of older adults are receiving their care, such as the financial burden. That Medicare Part D can't help with medications, which takes a significant portion of expenditure off of those elderly patients. The caregiver burden and the stress that they're placing on their families for taking care of them, as well as ageism included in language, public policy, and research. For our discussion topic, ageism sometimes affects the care of older adult patients. The best way to help is to prevent this with a self-assessment and discuss your feelings and attitudes with others. What kind of feelings, assumptions, or hesitations do you have when you think about working with an older adult? Are those feelings valid? And how can you change your perception? I can give you one story from mine. I actually used to work on the floor with a nurse who was still working bedside care in her 70s. And at first it was incredible. I mean, it's a 12-hour nursing shift on your feet is a hard job for anybody. I was in my late 20s and I was tired after work. She was still doing this in her 70s. But as you began talking to her, getting to know her, you realized she really couldn't stop working. She had a husband at home who was very sick, and then she also had a father who was close to 100 who was still at home. And she was caring for both of them and physically could not work. Unfortunately, the husband was sicker than the father. And just knowing what she was still dealing with, still working out there at the bedside, I really hope things worked out well for her eventually, because that would have to be a very difficult situation. I mean, yeah, bedside nursing wears me out. I couldn't imagine at that age. When it comes to healthcare decision making, they can take two different forms. One would be advanced directives and portable medical orders or living wills. These are advanced directives that the patient writes down and dictates what they would like to see happen should they be incapacitated and unable to make decisions for themselves. The other would be in the form of a guardianship or some sort of power of attorney. And these can take two forms: the court-ordered relationship, in which the selected guardian acts on behalf of another individual, the ward, or the ward can be proven to be unable to take care of themselves. Unfortunately, as they get older, it can get very difficult, especially when you have multiple family members involved. And if there wasn't a written directive from the patient, It can get very complicated very quickly as deciding who does have the final decision in making medical decisions for that patient. When completing your assessment, it should be in a private interview space with adequate lighting and low level of noise and distractions. You want to establish a rapport and convey warmth for the patient. Complete that physical assessment along with a very accurate med reconciliation, looking for polypharmacy, other prescribing cascades, and other complications. This is combined with a mental status exam, and older adult drivers should be assessed for their ability to safely drive, and any presence of elder adult abuse as well, which is unfortunately much more common than you would think. Assessing the use of multiple medications for the same condition, polypharmacy, includes prescription, over-the-counter drugs, and herbal agents. Adverse drug reactions or negative responses to drugs are common in the older adults, and these prescribing cascades can happen when drug-induced symptoms are treated with more drugs. The provider may assess the side effects of the first drug as part of the original medical problem or a new one, and begin treating that with more drugs as opposed to identifying it as the adverse reaction that it really is. Continuing with our case study, you're preparing to interview Mr. Nixon. What are some techniques the nurse could use to help the patient feel more comfortable? Conducting the interview in a private area. Introducing yourself and asking the patient what he or she would like to be called. Use of the first name is rarely appropriate unless one's invited to do so. You gotta think there's a major generation gap. From there, establishing a rapport and putting the patient at ease by sitting or standing at the same level as the patient. Also, ensuring the lighting is adequate and that noise level is low. They may be hard of hearing. You want to minimize any distractions as we can, especially with just normal aging process. Your hearing will decrease in acuity a bit. Recognize the fact that hearing and vision may be impaired. Use touch with permission to convey warmth and while at the same time respecting the patient's comfort level. Summarize the interaction, invite feedback and questions, and thank the patient for giving his time and information. Make sure we're going slow. Use the teach back method if it's appropriate. Think of ways that you can ensure that the patient understood what we were talking about. All too often, especially with their hard of hearing or with confusion, they can also often be embarrassed by that and kind of pretend. They may be nodding and smiling like they understood, but in reality, they didn't really hear you or they didn't really understand you. And you really want to take that extra step and make sure that they do understand. For our next audience response question, Mr. Nixon, who has difficulty walking because of shortness of breath, secondary to COPD, says, "Every day is a struggle when you get old. No one cares about old people. Select the best response. A, rest periods are important. Don't try to overexert yourself. B, it sounds like you're having a difficult time. Tell me about it. C, let's not focus on the negative. Let's talk about the good. And D, are you still able to get around and remain alert?" And that answer here is going to be B. It sounds like you're having a difficult time. Tell me about it. These therapeutic questions and appropriate therapeutic questions are going to come up a lot. And a lot of times that correct ATI NCLEX response isn't necessarily the one that sounds the most natural. But it's usually going to be that one that is an open-ended question that requires them to elaborate. It provides empathy while leaving it open for them to tell you about their problem in their own words. Some essential safety diagnoses include risk for injury, risk for falls, impaired ability to manage medication regimen, victim of elder abuse, and confusion. The higher level needs fall under Maslow's categories of love and belonging needs, and as well as esteem. And some nursing diagnoses address these higher level needs, such as loneliness, hopelessness, impaired role performance, chronic low self-esteem, and disturbed body image. Often as they get older, they're becoming more and more isolated. They're more and more at risk for abuse. And these are all major considerations we need to take into consideration for the care of this patient. For our psychotherapeutic methods, combine empathy with active listening to encourage ventilation of feelings and reestablish an emotional equilibrium. Provide health education and alternatives. Assist the patient in problem solving. Group counseling to help build relationships and reduce isolation, and in combination with pharmacology. Other treatment modalities include psychological therapies, reminiscence, which is a cognitive stimulation activity that engages individuals in socialization and rapport building, It assists to evoke pleasant feelings or memories and is an effective method to improve the patient's mood, particularly in those with memory impairment. Continuing with our case study, Mr. Nixon's son drives back down and the next weekend so they can meet to talk about his options for a more permanent living situation. As part of this process, the son has made an appointment for the two of them to meet with a nurse, who can help them explore their options. His son asks, "So what kind of choices does Dad have at this point?" For hospital-based care, partial hospitalization versus inpatient could be considered to both provide the patient with the care that they need, as well as try to provide them with as much independence as possible as well. Other home-based services such as daycare programs, home health care, community support services, and respite care may also be considered. This could be in combination with another form, which is residential care, which could take many different forms ranging from assisted living to skilled nursing facilities. Mr. Nixon's son heads to home again and says, "I'll be back again next weekend, Dad. Keep thinking about what sounds good to you. You can call me anytime." Mr. Nixon feels a little better about his future, but says, "It's just a lot to think about." The nurse suggests that Mr. Nixon might benefit from group sessions with others who are trying to make similar plans. This may not only aid in decision making, but help him to feel less alone in his next big step. For our next audience response question, a community mental health nurse plans an educational program for the staff of a home health agency specializing in care of the elderly. A topic of high priority should be A. Identifying clinical depression in older adults, B. Identifying nutritional deficiencies in the elderly, C. Providing cost-effective foot care for the elderly, or D. Psychosocial stimulation for those who live alone. And that answer here is going to be A. Identifying clinical depression in older adults. While all of these may be appropriate interventions, your highest priority is always going to be the greatest danger, which is going to be clinical depression in the older adults, because suicide rates are extremely common in the elderly, much higher than you would think. Mr. Nixon needs help with his prescription ordering. Which component of Medicare assists seniors to pay for prescription drugs? Would that be A, Part B, Part C, or Part D? And that answer, of course, is Part D. That is the component of Medicare that specifically focuses on assisting the elderly with prescription medications. And finally, a family member of a patient with advanced dementia says to the nurse, "I'll sign the consent for my mother's surgery." What is the nurse's best response? Would that be A, "This should be a family decision. When will your siblings arrive?" B, "Can you please show me the court order designating you as guardian?" C, "Thank you. Please use a black ballpoint pen to sign." Or D, "The patient is able to sign her own consent." And that answer is obviously going to be B. We need to verify that the patient is a legal guardian and can legally make healthcare decisions for that patient. A guardianship is a court-ordered relationship in which one party, the guardian, acts on behalf of an individual, the ward. Many people with mental illness, mental retardation, traumatic brain injuries, and organic brain disorders such as dementia have guardians. It's important that healthcare workers identify patients who have guardians and communicate with the guardians when healthcare decisions are being made. Care for the elderly can be extremely difficult, especially when you get family involved. It's a very high-stress time. They're going through a lot, both dealing with the end-of-life care for their loved one, and then you start adding medical requirements, legal requirements on there. Things can get very difficult very quickly. But anyway, that's all I've got for this chapter. I'll see you in the next slides.